And what happens is the person develops anxiety about their anxiety. Anxiety, the way that it operates is we tend to avoid the things that we're anxious about. Hi, this is Jim Breon. Welcome to this YouTube channel where we discuss all things mental health. Today, I'm going to be talking about anxiety disorders, various kinds of anxiety disorders, and what can be done to manage anxiety. Anxiety and stress are things that we all experience, and they're really a sort of a natural part of living. And stress and anxiety are not always bad. I think we tend to think of them as something we don't want, we want to get rid of. Stress and anxiety can actually be a signal trying to communicate something to us, maybe to get prepared for something, get ready, or a motivator to action. Some anxiety before a big presentation is actually a motivator for you to prepare and make sure that you have all of your material ready. But when stress and anxiety become chronic and unmanaged is really when it starts to become problematic. And people can develop an anxiety disorder, which is when their anxiety level is high, chronic, and unmanageable. A lot of our anxiety is actually driven by something called rumination. Rumination is repetitive thought processes that we get engaged in. It's sort of like when your mind gets stuck on some subject and you just keep thinking about it and thinking about it and thinking about it. And then if we also have some cognitive distortions like catastrophizing, that rumination turns into worry thoughts, turns into anxiety. But there are definitely things that you can do to manage that. When we talk about anxiety disorders, there really are 5 main types. The first is what we call generalized anxiety disorder. This is when somebody experiences chronic worry, lots of tension, anxiety even when there's no trigger for it. There seems to be no immediate reason for it. So it's generalized, it's not just in one specific incident, but it's in all areas of your life. That's what we think of as a generalized anxiety disorder. Another form of anxiety disorder is obsessive compulsive disorder, or OCD. This happens when people have recurrent intrusive thoughts. We call those obsessions. And then we have behaviors or compulsions that people use in hopes of getting rid of those thoughts or preventing them, making them go away. And often people will develop rituals. Rituals can be counting to a certain number, opening and closing a door a certain number of times, continually checking to see if the door is locked or the oven is turned off, that sort of thing. The problem with the compulsions is they can provide temporary relief, but in the long run, they actually continue to undermine the person's trust in themselves. Every time you check the door, you get a little, but then you feel like you have to keep checking it again. And a huge part of working with OCD is dealing with a person's struggle with uncertainty. The fact is that almost nothing in life is uncertain, but a person that struggles with OCD really needs to have a sense of certainty about different things. Something that's very closely related to OCD is a form of anxiety disorder that we call health anxiety disorder. It used to be called hypochondria. This is when a person has a preoccupation with health, always worrying about whether they're going to get sick or contract some illness, and they can have worry thoughts and images about illness. They repeatedly check for signs of illness. They can spend hours on the internet looking at websites and diagnosing themselves with all kinds of disorders, and in hopes that they can catch it early or find the exact cause for all of their distress. And it causes a lot of emotional distress. They have excessive and out of proportion anxiety about getting or having a serious illness. And they're not reassured when they get a negative test from a doctor or the doctor tells them that there's nothing wrong. Sometimes that will even create more anxiety because now the doctors don't know what it is, or maybe it's some rare thing that they've never heard of. So health anxiety is another form of an anxiety disorder. And then there's panic disorder. Panic disorder is when a person has unexpected and repeated episodes of intense fear, and then very strong physical symptoms that are associated with that. And then the more the person focuses on those physical symptoms, they actually increase. And what happens is the person develops anxiety about their anxiety. They might feel some anxiety and notice that their heart is racing, and then they pay attention to their heart racing, and then they start to catastrophize about that. And they'll tell themselves, oh my God, my heart's racing. I wonder if I'm having a heart attack. Oh my God, I'm having a heart attack. And the next thing you know is they're spiraling into that rumination, just spiraling into a panic episode. And anxiety and panic is triggered when our brains have released all of the stress chemicals that we store in our brain that we need when we're really in danger. And that cascade of neurochemicals creates what we call the fight, flight, freeze, and appease reaction. And those main chemicals are cortisol, adrenaline, norepinephrine. And every time a person with a panic disorder ruminates about, oh my gosh, I'm having a heart attack or something horrible is going to happen, the brain keeps putting more and more and more of those stress chemicals into the body, to the point that the person feels like, I'm going to die or something horrible is going to happen. Another type of anxiety disorder is post-traumatic stress disorder, or PTSD. And this is an anxiety disorder that occurs after being exposed to trauma, whether it's shock trauma or complex trauma or even developmental trauma. And this involves intrusive thoughts, often a real startle reaction, something we call hypervigilance, where the nervous system is always on guard, waiting for something to happen and preparing to react to it. And then the last form of anxiety disorder that we think of is social phobia or social anxiety disorder. This is when a person has an overwhelming anxiety and excessive self-consciousness in everyday situations. This can be situational, where you might have social anxiety when it comes to meeting new people or speaking in public, or it can be generalized to the point that you're just afraid to be judged by people, and you might isolate, stop connecting with people, and it can be a really debilitating disorder. So when it comes to anxiety disorders, there is treatment, and some of it is actually very effective and can help people get back to having more of a normal life. In general, anxiety, the way that it operates is we tend to avoid the things that we're anxious about. And the more we avoid them, the more anxious we get about them. So much of anxiety treatment involves what we call exposure and response prevention, meaning actually exposing yourself to the things that make you anxious and not doing the compulsions or the avoidant behaviors that keep it in place. Avoidance behaviors meaning, avoiding going to being in public or talking in public or meeting people, that type of thing. Much of the treatment involves learning stress management, mindfulness. Sometimes breathing practices are super helpful for people, and also becoming aware of what we think of as emotion vulnerability factors. Are you getting enough sleep? Are you eating regularly? Are you getting some exercise? Taking care of physical illness. Therapeutic approaches that can be really helpful in dealing with anxiety disorders are things like acceptance and commitment therapy, mindfulness-based stress reduction, cognitive behavioral therapy, and sometimes existential or psychodynamic therapy, depending on the nature of the causes of the anxiety. And there are medications that can be used to treat anxiety. Many SSRIs or antidepressant medications also have an anti-anxiety component to them. And things like hydroxyzine is a very strong antihistamine that can be used to treat anxiety, as well as benzodiazepine medications. Those, however, have some warnings that go along with them because they can be addictive. And once somebody becomes addicted to a benzodiazepine medication, detoxing from it and recovering from it can be a very, very difficult process. Another type of medication that can be helpful in treating anxiety are called beta blockers. Those suppress the physical symptoms of anxiety. And you know, as far as taking care of yourself at home, there's actually a lot that you can do to manage anxiety. Exercise is actually one of the best things you can do to manage anxiety and depression as well. Meditation can be very helpful, learning mindfulness practice, learning breathing practices that engage the relaxation response, and aromatherapy can be very helpful in calming the nervous system and, you know, avoiding things like caffeine, energy drinks, that type of thing. So that's kind of an overview of different anxiety disorders, and I hope the video is helpful. I encourage you to like and subscribe, sign up for notifications so you can know when more material is coming out. And feel free to leave comments or questions and let me know what you think and what you might like to see or hear about. And until next time, take care of yourself. Bye-bye.